Hello, once again. Welcome and welcome back to Medwell podcast. So we are back. We are back again. We are active. We are so strong. We are healthy. And we are here to inform you once again on a new topic. As always, your host is Réponse Aurore Ishimini Ngirinchuti. And today we are going to be talking about a very interesting topic. You might have heard it nowadays in your societies, on TV, in the communities, from your leaders in the hospitals, from the pharmacists, from the veterinarians, anywhere. Today we're going to be talking about combating antimicrobial resistance as part of overall wellness. But I'll not be alone. I'm going to be joined by a very informed and wonderful guest. How are you?
I'm good. Thank
You're
you for
feeling
having me.
You're feeling great?
Sure.
Would you mind please introducing yourself to our viewers on Medwell podcast?
Yes, thank you so much, Alol, for having me today. My name is Marcel Shimge, and I'm an aspiring pharmacist, also the founder and ex-CEO of AMR Institute Rwanda, which is a non-profit organization tackling antimicrobial resistance in Rwanda using One Health approach. Maybe we have time to talk about it, how we work, and what we are doing to tackle this burden of drug-resistant infections in our country.
Yes.
Thank you.
You're welcome. So you mentioned of how saying on how you tackle antimicrobial resistance, but most of our viewers are now thinking like antimicrobial resistance is like a scientific, a very bombastic word that is more scientific, laboratory related. So I want you to give them a very simple definition that is going to take the matter or the issue like personal, individually. How can you explain it to a random person in the society there?
Okay, thank you so much. When we talk about AMR or antimicrobial resistance, it simply means when the medicines we use every day to treat infections which are caused by microorganisms no longer effective to those infections.
Yes.
And it poses different threats to our communities because when someone cannot be treated with those medicines, it results in longer hospital stays, increase the burden of financial burden to the families and others, because even some people may die, or they usually die because of those resistant superbugs they are having. Thank you.
So Mr. Marcel mentioned that those drugs or medicines are no longer responding to the like a certain disease that you are suffering from. So dear viewer, you might have thoughts like after opening the video, you have thought maybe antimicrobial resistance. I'm going to maybe hear about the doctors, the pharmacists, all those like scientific people in this issue. But you have understood that you can also be involved as long as you are in this world. You can be a patient. You can be a patient of any disease, any bacterial infection, any viral infection, or a fungal infection. So this is also your matter. You have to also combat this antimicrobial resistance. As you have got from the definition of Marcel, it's also your issue. It's also something that you can combat. So, dear Marcel, you mentioned in the introduction that you are a founder of AMR Initiative in Rwanda. So, like, that made me like get curious on what like drove you throughout your journey, that showed you that you have to take action. You have to bring out an initiative that combats antimicrobial resistance. Most of the people, maybe one can bring out an initiative about NCDs, non-communicable diseases, hypertension, diabetes. We all know that. But why did you choose antimicrobial resistance, like specifically?
The main reason I chose to work on antimicrobial resistance is because when I first got in the pharmacy school,
Yes.
I usually explored more about pharmacy. What is pharmacy? That's where I got the connection between pharmacy, public health, and even our communities,
Yes.
most especially around the use of medicines when they are not used well. So when I understood the real problem which is occurring in our pharmaceutical sector and even in the public sector, public health sector in general, I got motivated that what can I do to bring my contribution to our country to protect the community from facing the burden which are which are being caused by drug resistant infections. So, and it was also related to my career
Yes.
because I wanted to contribute my efforts to the public health in Rwanda.
Yes.
So I explored more about AMR because I got to know AMR since I have known that I will study pharmacy. So after that, when I got to the university, I kept exploring and found that I have to work on that drug resistant infections.
Yes.
Then I sat and explored how can I work on this. That's
Yes.
when the idea of founding an organization came. Because
Okay.
at that time we were implementing our first national action plan on AMR, which later was renewed.
Yes.
Now we are using the second national action plan on AMR, which will last till 2019. And I got to read more about the problem in that document,
Yes.
and I found that I have to contribute my efforts in tackling this problem. That's why I founded an organization that is working to tackle AMR holistically, not focusing on one sector. We focus on human, animal, and environmental sectors because resistance knows no border
Okay. Yes. True.
between
True.
different sectors. That's
Yeah.
why we focus on human, animal, and environmental sectors to tackle AMR holistically.
Yeah. Holistically. Thank you so much for that bright answer. Dear viewer, you are a student. You are maybe studying engineering. You are studying medicine. You are studying nursing or whatever that I didn't mention above. Are you studying because you want to change the world? You want to change Rwanda. You want to minimize those huge statistics of those diseases that are killing people day by day in Rwanda or even in Africa at large? Or are you just there to fulfill your parents' wishes, to fulfill the village's wishes, to show that, oh, I studied engineering. You see me, I did engineering just like that. Or you are there to change the world. Learn from Marcel. He is a very good example. As we continue next, we have not forgotten that we are on Medwell podcast, which talks about wellness in general. So this brings me to my next question, Marcel. So we usually talk about wellness as social, physical, mental, or emotional well-being, usually in our past episodes, or maybe in the society, in the hospitals. So where does antimicrobial resistance fit in all that category?
Uh, AMR and wellness are connected because I can say our ability to treat infections and prevent infections affect the overall well-being of the community, because when these infections are prevented from reaching the communities or even people are cured from those infections,
Yes.
the overall well-being increases. This I can say AMR does not affect the body itself only. It affects your physical, mental, social well-being. That's why we say it's connected. MR and wellness is connected, because think of a family which has someone who is in a hospital, who has long hospital stays because of this AMR
Let's take a simple disease like cough.
cough.
Like a person is suffering from cough and is oftenly going to take medications in a pharmacy, self-prescribed, not prescribed by a doctor, just because he or she thinks he surely knows that he has cough and it's just normal cough. Start from there. A person with cough going to the hospital, like
Yes,
that,
I can
and
say
building from
cough.
it.
Cough mainly doesn't get to it's a viral infection, but
Yes.
it doesn't usually get to us that can make people to have long hospital stays.
Yes.
Let's take a look on TB. Do you
Okay.
know
Yes.
TB,
Yes.
MDR TB?
Tuberculosis.
Multi-drug resistant
Protozoonose. Yes.
tuberculosis.
Mm.
When someone has that MDR TB, can face long hospital stay in the hospital. So that affect the families that person is coming from, because staying in the hospital affects someone mentally, socially, and even financially, because
Yes.
that means the person is being a burden to the family, because you cannot stay in the hospital for nothing. You have to pay.
You have
You
to
have to pay
pay
for the
to
medicines.
eat.
You have to eat. You have to pay anything
Yes.
for you to be able to stay in the hospital. So that affects the communities in different ways. So that's
Yes.
why we say AML or drug-resistant infections affect the well-being of the person
Yes.
and the community.
Okay. Okay. So, previously I gave you an example of a person suffering from cough because in the conferences that I had a chance to attend, tackling antimicrobial resistance, they focus more on those neglected disease.
Okay.
My cough might be a symptom of TB. It might be a symptom of an infection. Different diagnosis. But a person just thinks it's just mere cough and tries to self-dispense the drugs from a pharmacy, and the pharmacist just give out the drugs to that person, and as the person tries to consume those drugs more oftenly, you find that the microbes become resistant to that type of medication. So I wanted you to like explain to the people who still have those kind of mindsets that there are diseases which can be curable. Nowadays, people are also self-diagnosing malaria, and they be like, "Oh, I know if I am vomiting, if I have general body weakness, if I have fever, so it's malaria." Boom. Let me go and get Quartem. So, how can you what's the advice can you give to those people to change that kind of mindset in the Rwandan society or even Africa at large or maybe the whole world?
Yes. That should be done and respected by anyone,
Yes.
because when people misuse or overuse any type of medication, whether it's antibiotics, antivirals, antifungals, and even antiparasitics, including antimalarial drugs,
Yes.
it causes those microorganisms which are being treated by those medicines to no longer respond to those medication. So I can advise anyone who are hearing us to take the medication as prescribed by the doctor, and even don't try to diagnose yourself,
Yes.
because sometimes you can have a symptom and you guess a disease, and maybe it will not be the one which you are guessing. So you have to consult your doctor for him or her to diagnose well the disease and prescribe the medicine which is light for you.
Yes.
After light prescription,
Then
you go to the pharmacy and they dispense the medicines.
Yes.
The law now it's yours. Take the
Okay.
medicines as
As
prescribed, and
prescribed.
even don't misuse them. If they have told you to use the medicine 3 times a day, you have to use as it was prescribed by the doctor and even dispensed by the pharmacist.
Yeah.
So we have to use the medicines well, appropriately, for us to prevent the lives of this drug-resistant infection. And there is another thing that people are doing outside here, which is like sharing medications.
Yes.
Like I may have a symptom like the one you said, cough, or even common cold,
Yes.
and I take the medication from the person, from the other medicines which have brought by someone in my family. Like
Someone
you have
else.
gone to the hospital and they have given you your medicines. That's a problem. You have not even completed your dose,
Yes.
and you are sharing your dose to someone,
To your sister.
to your sister or someone in the family. So you have, for you have a problem because the microorganisms you are treating, you are making them, you are making them feel like what you are giving to them is not effective, because
Yes.
if you don't complete the dose as prescribed, you make those microorganisms no longer respond to the medicines, right?
Yes.
So, and for the people who in your family also, you will not get the real dose, right? So that problem is coming from you, also you're passing to your family member,
My reality.
to your
And the chain continues.
yeah, and the chain continues. So it's a problem, and you
Mm.
should work closely, should collaborate to tackle that problem. Teach our communities how they should use the medicines
Yes.
effectively.
That is really a big issue because people nowadays, I was going to use a word, they think they are smart. Yes, you are smart. You are so smart indeed. But sometimes you overdo things. Nowadays we have ChatGPT, we have Gemini, we have Cloud AI. And people are using those artificial intelligence tools to diagnose themselves. Dear ChatGPT, I have cough. I have for 2 days. What can I take? And ChatGPT cannot miss. It is going to tell you something to do. And then you go out there, take those medications. You are not an MRI. You're not a chest X-ray. You're not a CT scan. You're not a lab technician to culture and see those microorganisms. Is this a staphylococcus? Is this whatever? And you just give yourself medications. What are you even treating? Do you know what even it is? Today, let me give you a short story. I was in OPD. I was welcoming patients, in the outpatient clinic,
Yeah.
and the patient came in like, "Doctor, I can feel my kidney. I know that my kidney is very hurting, and when I move, I feel like I'm moving with it. A kidney, like I know even if I sit, I am sitting on it, and I feel it, and it gets hurt." I was like, "Have you even seen a human kidney before? Do you know what you're talking about? Do you know what you're talking about saying you are moving? As you're moving, you feel your kidney is moving alongside with your leg." That shows you the mentality that people have, that they outsmarted this X-ray, this imaging, that they outsmarted the lab tests, which is very dangerous, by the way. So if that patient, you understand that he surely knew that it's the kidney problem, it's the kidney issue. If he went in a pharmacy and said, "I have a kidney issue," and the pharmacist is not, maybe, let me use this word, maybe if it's not very appropriate, wise enough to say, "Where is the prescription? Where is what and what?" Or they're even friends. You have a pharmacist friend, and then they'll be like, "Okay, take furosemide, maybe. Take spironolactone. It's going to take the pain away, to treat your kidney." That is a very dangerous thing. So, moving on next, Mr. Marcel. Throughout this journey, finding an initiative, an AMR initiative, you have met some challenges, obstacles. You have also made a lot of achievements throughout that journey. Can you tell us one of the things that you encountered throughout your journey that you say, "Oh, I did well here," or Rwanda is doing well, or pharmacists are doing well, or doctors are doing well, or patients are doing well on this issue, that you appreciated on this journey to combating antimicrobial resistance?
Thank you so much. One of the challenges we face along the way as an organization, not we only, But in general, the organization is uh, having abilities to do effectively the programs, right?
Okay.
Here we say technical assistance and even financial assistance.
Yes.
That's what most organizations here face, and I can say we are trying to overcome it. Now we are in a good stand.
Yes.
That's one of the challenges we have faced. I can say we're still facing it, but we are in a good position. That's on the side of the organization. On the side of the communities is there are still misconceptions in the
Yes.
communities around the use of antibiotics and even other antimicrobials. So, knowing how to coordinate different communities, people with different skills, knowledge,
Yes.
uh, and
Understandings on some
understandings on
things.
something,
Yes.
so is one of the problem we are facing. But we are working on it. Another thing is changing the mindset of some of the community health workers and even the including the doctors and pharmacists,
Exactly.
because they take mainly, I will say, on the pharmacy side, they take the pharmacy as a business career, right? So they do their job like focusing on
As
the
long as I give out the medication and I get money.
everything's is good.
Yes.
So that's a problem because they're not focusing on the public health, they're just focusing on the business.
Yes.
Not all pharmacists they do that, but some, right?
Course. Yes.
They, I know
Some.
some can throw stones on me, but
Yeah.
that's usually what is happening outside here. So we're trying to work with different organizations which are in charge, including the National Pharmacy Council and
Yes.
other institutions, to see how we can teach, train, and do advocacy on
Yes.
that problem
Which
until
is
it be
what
solved.
you are doing here on Medwell podcast, right?
Yeah, that's
Yes.
true.
You are talking of more of the challenges,
Yeah.
but I assume this journey is not only made of thorns or thorns. You have not only made thorns or challenges, those obstacles. I hope you have also made some achievements throughout the way, or something that you have appreciated from the government. You say, oh, the government is doing good here. Some of the organizations are doing good on this certain topic. Like, what's something that you have appreciated or you have achieved in this journey?
Uh, our achievements are many, but the most thing I have appreciated as the founder,
Yes.
because most founders face it, is the government understands the problem and they are willing to help anyone, any
Yes.
organization which is
Yes.
working to bring the solutions on this issue.
Yes.
On the journey, we are receiving contribution from different governmental institutions that are helping us to implement our activities, programs aimed at reducing these challenges in our communities. So we appreciate that contribution and we are hoping we'll keep receiving them to enable us do our work effectively.
Yes. A round of applause. Shout out to the government. Thank you so much for your enormous support. Okay. So then, last but not least, yes, you are not only a founder, sorry,
It's
founder
okay.
of AMR Initiative, you are also a pharmacy student, but a senior pharmacy student to add on that. You're not a
It's
young,
okay.
young pharmacy student, you're a senior pharmacy student. And you are a person standing between a patient and that antibiotic that he or she is going to take. Like, what is your role to now tackle antimicrobial resistance? You have talked more of it, but you can add on something for them to hear it properly and put them in here.
Yeah, what I can say, here we're talking the role of pharmacists to help tackle antimicrobial resistance is we as aspiring pharmacists and even the pharmacists who are already in the career,
Yes.
we have to take this issue as ours,
Yes.
right? Because every time when you or we dispense the medicines without focusing on the real challenge of the patient, the public health, because uh, we are we are willing to get the money
Yes.
by putting aside the public health.
As long as we get the bag.
That will be an issue. So my advice is, you can do both.
Yes.
You can do your work well and still get the money, right?
Of course.
So and you will be giving contribution to your country, to your community, even to your family.
Yes.
Because when someone has these superbugs, drug-resistant infections, you can pass them to another person, right? So maybe if you think if you don't do that for your family member, you do it to another person, you will not receive a problem. But
Yes.
sometimes you can get those resistant genes also.
Yes.
And that will be a problem. Imagine if you have someone from your family and any medications which are on the market are not working to
For
treat him or her.
That is so
That is a
sad.
problem. And doesn't
So
go
sad.
to the other people, excluding yours, right?
Okay. Yes.
So let's take this problem as ours and do anything we see as positive to prevent this problem from spreading.
Yeah, so touching, so touching. So, thank you so much for that answer. As we conclude, World Health Organization, or what we know as WHO, has introduced what is labeled One Health, which involves 3 different sectors, all combating on One Health. In your previous question, you have answered about how pharmacists are responsible in the process of combating antimicrobial resistance. Now, WHO has brought in 3 different sectors. How do you think this is helping, and how do you think this is more efficient than only you pharmacists or people in only the health field, or pharmacists and doctors or nurses, like being included in the process or the journey to fight against antimicrobial resistance?
Oh, yes, when you say One Health, it's an important tool in tackling AMR, because One Health recognizes that the health of the human, animals, and our shared environment are interconnected.
Yes.
So think of, we give you an example of Marburg.
Yes.
You have had Marburg.
Yes.
Marburg is a zoonotic disease,
Yes.
right?
Mm.
It originated from the bats. Bats
From the
are
bats.
animals.
Yes.
And we faced it as humans, that our health
It's a circle.
are connected.
Yes.
Our health of the animals, our humans, and even our shared environment are connected.
Yes.
That's even goes to AMR,
Yes.
right? Because when we misuse antimicrobials, let's take an example, antibiotics in the animal sector,
Yes.
the animals can get those resistant microorganisms in them, right?
Yes.
And we consume meat, right?
A lot.
We consume meat, we
A lot.
consume milk, we consume everything from the animals.
Yes.
So we can get those resistant genes to humans.
Yes.
The problem comes from the animals to humans. So I may say One Health has changed different things from who is responsible to tackle AMR, from how can we tackle AMR together, because it establishes collaboration from different sectors to bring solutions together to tackle AMR holistically, not in a solo, because you cannot combat AMR as one sector only.
Yes.
Because you may put efforts from one sector and you leave another one behind. That sector you have left behind can still contribute to the problem to the sector which you have put much efforts. I've given you an example.
Yes.
Back in some years ago, we used to put efforts in the human sector by leaving the animal sector behind, and environmental sector behind. But nowadays government and even one health stakeholders have understood that we have to put efforts in each sector to combat this problem holistically, because resistance knows no border across different sectors. Policymakers, pharmacists, veterinarians, public health practitioners have to work together to bring the solutions at the table together.
Okay. Thank you so much. Thank you so much. Dear Medwell podcast lovers, if you are new, if you're old, I hope you gained a lot, actually more than a lot, from this particular video. We thank enormously Mr. Marcel for honoring our invitation.
Thank you so much. It was great to be with you in this podcast.
Yes, it was
And I
great
hope
from learning from you
keep
too.
doing this to teach our communities about health issues.
Of course, we
and
are here for
they are
them.
facing.
So before you leave, they want you to give them like a short message. That one they're not going to forget. That one they're going to think of self-dispensing a medication on their own. And they'd be like, oh, Mr. Marcel said this, let me stop. If a pharmacist sees this and she or he is going to dispense any medicine or drug without an ordonnance, they'd be like, oh, I don't have to say that. The floor is yours.
Okay, thank you so much. My message will be in different parts because of the people who have to get it. So for the people who are in charge of giving the medicines to the patients, because the problem arises from those who give the medicines to those who consume them, should respect the guidelines which have been set to dispense those medication, to prescribe those medication. Because if you don't do that, we'll be posing the threats, increasing the problem to our communities. For the pharmacists, for the doctors, tell your patients, your customers, for the pharmacists, about the use of medicines well, because if you don't give them the information, that's where the misuse and overuse will come from. But also consider the disease. If the medicine needs to be prescribed, tell the patient to go to the hospital for the doctor to diagnose and prescribe the real medication, because that's the problem we are facing, the pharmacist. Some medicine are given by prescription, but not by the after diagnosis by the patient.
Yes.
By the doctor. But some pharmacists give the medicines without having the document, the ordinance, as you have said, from the doctor. That's a problem. So we pharmacists follow that, and also give them message to the people who come seek the medicine in our pharmacies about how they should use the medicines. For the people in other sectors, let's collaborate together to implement different interventions which are aimed at reducing the burden of AMR, because this is a problem which requires cross-sector collaboration. Human, animals, and environmental sector should collaborate to bring the solutions to this issue. So let's collaborate.
Yes. Thank you so much, Mr. Marcel. There's this saying that, like, I've heard my parents say, even others say, qu'est-ce qu'on m'accusa dit, je n'ajoute rien. So, qu'est-ce que Marcel dit, je n'ajoute rien. So, thank you so much for tuning in. Remember to like, share, subscribe to Medwell Podcast for more and more interesting videos and very informative videos like this ones. See you next time. Ciao.